Depan kita Mr. John Lee untuk memberikan keterangan media terkait dengan One Health yang tadi pagi sudah dibuka dan didiskusikan bersama. Oke, Pak John Lee already come in these rooms to give some information about the One Health to us. Thank you, Mr. John Lee. The time is yours to tell about what is One Health that we're discussing this morning. Thank you.
Okay, thank you. Thank you very much. And it's my privilege to speak with you today. One Health is an approach which joins up different sectors when looking at health threats. And it's really important. If you look at something like COVID-19, right? We have all seen the effects of the COVID pandemic over the last few years, more than 2 years now. COVID is a disease which originated in wild animals, right, and then spread to humans. Most of the new diseases that are circulating in the world and have been for the last 20 to 30 years come from animals. And therefore, it's really important that we take an integrated approach to looking at animal health, environmental health, and human health. If we only look at human health, which is where we usually put most of our resources, most of our money, most of our attention goes into human health, we are dealing with the situation after it has become a crisis. We are dealing with reacting to a pandemic or an epidemic which can have huge consequences on human life, on human welfare, and on the economy of our countries. But if we go more upstream and look at where these diseases are coming from, we hope to be able to prevent more of these disastrous events from happening. If we could monitor what is happening in wildlife, for instance, that doesn't mean that we monitor everything that happens in all of the forests all over the world, but where do humans interact with wildlife? In wet markets, for instance, or when people are out hunting for wildlife. This is where there is an interaction between wildlife and humans, and that is a high risk that some of these pathogens, some of these diseases that are in wildlife could spread into the human population. So that's where we need to pay attention. But unfortunately, very few resources are given to those activities. Similarly, in domestic animals, there is very little investment in animal health compared to human health. We need more investment in animal health. And we need to join up so that the surveillance systems talk to each other. People who are monitoring diseases in animals, people who are monitoring diseases in humans talk to each other, the systems talk to each other, and then we can have a joined up response. One Health is not only important for preventing pandemics, it is also important for many other issues. Food safety, for instance. Antimicrobial resistance, where antibiotics are used widely in agriculture, and then the pathogens become resistant to those, and then that also affects human health. We need a joined-up approach across the agriculture and human health sectors to prevent this, what they call the silent pandemic of antimicrobial resistance. Various environmental issues also. How do we deal with the effects of pollution? How do we prevent pollution? How do we deal with the effects of climate change? These have health impacts, right? So it is not just about preparing for pandemics. There are so many other important areas where it is important, absolutely essential, for us to join up our activities across sectors, to collaborate. And this needs to start from the very beginning of our thinking. It was just pointed out in one of the sessions today that, when doctors are being trained and when veterinarians are being trained, there is very little interaction between them. We need to change that so that veterinarians are also thinking about human health and that doctors are also thinking about animal health. We need to be joined up in our approaches. This is really essential. This is the only way that we can overcome some of these pressing problems that are affecting the world today. Preventing the next pandemic, preventing antimicrobial resistance, making sure that we have food safety and even food security in all of the countries of the world, and dealing with the changing environment. It's really essential. Thank you.
You're welcome, Mr. Chun. Teman-teman, ini yang disampaikan oleh Pak Chun terkait dengan bagaimana pentingnya One Health, bagaimana menjaga dunia, menjaga negara, dan juga menjaga masyarakatnya dari safety food, antimicrobial resistance, climate change, dan lain-lainnya. Tiba saatnya untuk diskusi dengan Pak Chun. Kami persilahkan kepada teman-teman yang akan bertanya. Kami silahkan. Okay. Is there any question for you?
Okay, thank you. I'm Ismi with the Nikkei. I would like to ask, there's been mentioned the need for collaboration between the animal health sector with the human health, which more of a curative measures. I believe that's your concern. And how do you see in the context of G20? For the last 2 days, as well as previously had been agreed on the global level for health protocols, could really support this kind of initiative, this One Health, for surveillance at the animal health, as well as it would eventually, as you said, prevent the next pandemic or endemic. Thank you.
Yeah, thank you. Very, very good question. And I think the G20 is really important because, as we all know, the majority of the world's economy is controlled by the G20. I think something like 80% of the world's economy is in the G20 countries. Not only the economy, but also science and research, even higher proportion, maybe 90%. Is in the G20 countries. So it is really important for the G20 to take action, to take that action in close collaboration with the technical agencies, right? So we have the quadripartite who are represented here in these meetings. So with WHO, UNEP, and the World Organization for Animal Health, as it is now called, as well as the FAO. So they are working together on the One Health agenda, but that is not enough. They are the technical agencies, right? But the G20 control the resources. So it is really important for the G20 to address this issue. Yesterday, in the G20 meeting, we had a very good discussion about finding additional financing for pandemic preparedness and response. And there are some good proposals there. But we need to make sure that it doesn't just stop there, that we are not just looking at preparedness for the next pandemic and how we respond to the next pandemic, having stockpiles and having of medicines, having quick access to vaccines and all of that. Yes, but that is already a reaction, right, to the pandemic. We need to make sure that the G20 also allocates financing for prevention. Not that we have to react to the next pandemic, but that we also can prevent the next pandemic. And that requires a One Health approach.
Thank you, Mr. Chen. Any other question for Mr. Chen,
Hello,
please?
I'm Intan from Kompas Daily Newspaper. I want to ask how to make sure One Health doesn't just at concept, but can be implemented well. Thank you.
Thank you very much. Yes, and this is very important because I think, most people nowadays understand the importance of One Health and we need to do it. They understand the what, they understand the why. Yeah. The problem is the how, right? How do you do it? Because, in every country of the world, you have a separate Ministry of Agriculture with its own budget. You have a separate Ministry of Health with its own budget. You have a separate ministry which is responsible for the environment. It has different names in different countries, but again, it has its own budget. We need mechanisms that enable these different government agencies to work together. And not only to work together, but to have pooled financing. And that is quite challenging. It needs underpinning with legislation, and it needs some sort of institutional arrangement that has budgetary resources attached to it. Some countries are doing this quite well. We have heard recently examples, for instance, from Bangladesh. Bangladesh is not a member of the G20, but we can learn from good examples from countries which are not members of the G20 and apply some of these same principles in G20 countries. So, you know, that is not the only one. There are other examples, but we need to look at these examples of really good practice of how institutionally to join up some of these different government departments, which for very good reasons have their own structures, their own systems, which is quite right, but they also need to be able to join up and have access to joint finance that could be equally accessible to these different agencies. That's the next step, and we are working towards that. I can't say that we have got there yet. Some countries are making good progress, other countries not so much, but that's the way we need to go, and the G20 needs to take leadership on this. Yeah.
Thank you, Mr. Chuan. Mbak Intan cukup? Oke, Ismi cukup? Lina? Okay, thank you, Mr. Chuan. This is enough the times, and thank you very much for kindness to give information about the One Health to the journalists. And we wish this will be a good information for the world.
Thank you very much.
How One Health
My
to
pleasure.
prevent, how One Health to prevent next pandemic, and how ready the countries in the world to prepare for this, for the budget, for the collaboration with organization, institution, and others. Thank you very much for coming.
Thank you.
You're welcome.
It's my pleasure.